Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And of course, we're talking about putting patients first, and we have a phenomenal guest to do that today. A 20-year veteran dental hygienist and founder, Melissa K. Turner, is a sought-after executive, consultant, dynamic speaker, and top millennial content creator. Behind the most innovative brands in the industry, she partners with companies of all sizes, from pre-seed startups to billion-dollar international brands, and on brand strategy and product growth. Turner's combined experience behind the scenes, in the boardroom, on the front lines as a clinician, and as a public-facing influencer allows her unique insight into future industry trends. Melissa, thank you so much for being on the podcast.
Bryan, it's great to be here, and thank you everyone who's listening.
Well, you're, as you said, you're in parts of a lot, you're part of a lot of different parts of the dental industry. So first of all, how did you get into dentistry in the first place? It's a question I love to ask people who particularly went from clinician to something else in the dental industry.
Yeah, I mean, is it fate or luck of the draw? Most people I found who are in dentistry are in it because their dad was a dentist, right? Or they had an aunt that was a hygienist, and like that's their first foray into the industry. For me, it was just, hey, I didn't want to go to college back in the day. And so I looked in the newspaper back in the day to see what was, what's the most numerous job that's advertised in the classifieds, and it was dental assisting. So that's what I did. I circled all the little ads and I went and applied, and that was how I got into dentistry. It's not a sexy story, but it is what it is. And I wouldn't trade it for the world, Bryan.
Well, yours is a story of fate, probably. Mine is a story of completely flat logic. So you probably win that round. But yeah. So then how did you make a pivot from doing clinical care to sort of supporting clinical care?
Yeah. So I think, no matter what industry I would have ended up in, I would have gone on this path. The pivot point was when I had my first kids back in Minnesota, where you're from. I didn't want to work clinical anymore, right? I wanted to find out, what can I do working from home? It's that same old story, that adage of like working from home, like side hustle. And so I said, you know what, like my strengths are in leadership and speaking and seeing the future of things and big picture strategy. So how can I apply that in dentistry? And so fast forward a decade, and that's where I am. I work with a lot of product and service companies with brand strategy, with new product launches. I coach individuals on how to leverage their personal brand to grow their businesses. And then I also am a huge advocate for teledentistry and basically the future of dentistry, which I have a feeling we'll talk about today a little bit.
Absolutely, we will. Yes, it's one of my favorite topics, as well as teledentistry. So let me ask, because I'm a huge teledentistry advocate myself, and I feel like it is probably one of the most transformative technologies that during COVID people cared a lot about for 2 weeks, and then it had sort of like there wasn't a lot of education, and so I feel like, my opinion, you can validate or discredit or discredit it, that teledentistry is a transformative technology that had like the worst product launch ever, almost, that really just needs, I think most people who don't believe in teledentistry should really kind of get educated about how to apply it in their practice. Do you agree with that?
Mm-hmm. And that's what we've been working on. So I'm co-founder of the National Mobile and Teledentistry Conference. And what the premise of that was that, okay, we've got to stop thinking inside the four walls of our brick and mortar practice, right? Once we start thinking outside of the four walls, then we understand how our bottom line grows, how our P&L completely changes because we can reach more patients. But what we're used to thinking traditionally, what dentists and practice owners are used to thinking is that, oh, I have to build on, or I have to have a de novo practice, or I have to be a part of a DSO in order to get more patients and make more money. When really we've got same store growth going on right now. If you can make more money on the patients that you have without building on, if you can reach them virtually or go to their workplace or their home with concierge dentistry, these are the things that are growing dental practices right now. But it's a learning curve. I'm going to talk a lot about mindset, and especially in 2024, I'm going to talk a lot about mindset from the stage, but it's really a mindset change, and it'll happen, Bryan, but I think we're kind of waiting for the changing of the guard for maybe the millennials to own most of the practices, right, to be the decision makers in dentistry in order for teledentistry to really take off. It's kind of a waiting game right now. We saw a spike over COVID and pre-COVID, but we know telehealth has taken off and we follow those trends, right? So it just takes us a little bit longer sometimes in dentistry.
Well, as a offended Gen Xer myself, I have to, no, I'm just kidding. But I do think so. Let's talk a little bit about the future of dentistry because you touched on some things that I think we've been talking on this podcast quite a bit about. And I'll tell you where I believe we are and where we're headed as an industry and why I feel like like you said, it feels like we're kind of at this stagnation point.
Yeah.
And I think it's because we're on the precipice of a new age in dentistry. I call it dentistry 3.0. Like 1.0 is like, you know, four-speed or four-handed dentistry, having hygienists in your practice and high-speed hand pieces and all of that stuff. 2.0 is digital, we're talking CAD CAM, CT imaging, 3D printing, right? And 3.0, I call it connected dentistry. And I think that themes of this next phase of dentistry are going to be medical dental integration, interoperability, kind of my focus area is solving the problem of interoperability, because I think that's going to kick this all off. Remote care and patient empowerment, which is, I think, it's patient empowerment, remote care, and medical dental integration seem on the surface, and interoperability, they might seem like very different things, much like 3D printing and the way AI is leveraged today, and CAD CAM is those are different segments, but they're all part of the same theme, right?
Mm-hmm.
And so I feel like the reason why we're stuck right now is because we're at the end of 2.0, the 2.0 era. We're entering 3.0, and there's going to be a couple things that really tip the scales. And if you looked at being a Gen Xer, I saw sort of the beginning of dentistry 2.0, and you looked at it in the beginning and were like, what the hell is that? What, like this CAD CAM system made no sense.
Why would I use it?
Right. Yeah. And there were people who loved it and used it. And you're like, you freak, what are you doing with that in your practice? Right. And the difference is that was hard. The beginning of dentistry 3.0 actually makes everything easier. But to your point, and kind of where I think where you're headed from the stage, is the barrier isn't technical, it's psychological.
Yes.
Would you agree with that?
It's completely psychological. And I get it, as I don't own a clinical practice, right? But I own businesses. And I understand right now that the most important thing in any business, inside or outside of dentistry, is understanding what your consumer wants. And, Bryan, back in the day when I started in dentistry, it was really, really a bad thing to call your patient a consumer, right? It was really a negative. You didn't want to do that. But now it's kind of like, millennials and the next generation, we're used to being treated as consumers. We want to be sold to. We're used to being marketed to. That's why there's so many marketing degrees right now, coming out of college, and that's our love language. And so right now, like even this is a mindset change, understanding that the patients right now, the millennial patients, which are the patients of your future, kind of want to be treated as a consumer because that's what they understand. That's what they know and trust. And, oftentimes if I walk into a business and no one's selling to me, I'm like, what's happening here? Like, this is weird. Like, what's the catch? But if I walk in and I'm like, okay, this is a business transaction, I'm being sold to and marketed to, it makes me feel comforted. And so, that's not top of mind for most millennials, but because I'm in marketing and brand strategy, I understand that. And so it's a mindset change for the business owner in dentistry.
Well, I don't think I've ever been on a podcast where I felt older, because having marketing be a love language is a foreign concept to me that I'm going to have to think about for a little while, because that's Gen Xers don't feel marketing as a love language. Probably the opposite, right? Like ignore us and then we're happy. But I digress. What other psychological mindset shifts? What are those? Because I don't think myself, as somebody who has dental practices or had dental practices, that doesn't understand that marketing is a love language. How could you give people tips to kind of apply that to their practices today?
Well, I think one of the things, and it's kind of harsh when I say this, but millennials and below they don't want to see the dentist. They don't care if they see the dentist. They don't care who the dentist is. They just don't care, right? You know, back when I first started in dentistry, it was always, the practices were called by the dentist name, Dr. Harry Potter Dental, right? Now that's going away. You would walk in back then and you would see a wall of plaques and certificates and diplomas of this is the dentist and this is why he's credible and an expert. And now patients don't care about that, Bryan. They just don't care. They want to get back to their Instagram feed, to their TikTok feed. They want to get back home. They don't want to be in the dental practice. And I think often in dentistry, we forget it's a beloved industry to us because it has to be. We have to run our businesses on it. We have to keep loving it because our patients need us to. But we often forget that nobody wants to come to the dentist. And in fact, if they come to the dentist and they don't even see the dentist, it might make their day, right? Because dentists make anxiety in the patient. And it's things like this that we often just forget in dentistry because we're in it. We're too close to it. And I went into my primary care physician the other day to take my kids to their well child appointment, and it was a new practice and everyone had masks on. I had no idea who I was dealing with. I didn't know if it was an RN, an LPN, a mid-level provider, or the physician or the front desk person. I had no idea who I was dealing with. But I didn't care as long as the service and procedure was getting done. And I think that's a mirror image of kind of what's happening in dentistry and what has been happening in dentistry for a while. And especially now that everyone wears masks more than they used to, we're just kind of faceless to them. And so another mindset is understanding that patients are okay not interacting with the dentist at each visit. That's a huge mindset to get over in dentistry.
Oh, huge. Yeah, I think that's some really great perspective. My practice was originally called, this is like embarrassing to admit, but it was called Bryan Laskin DDSPA. And then, but then, obviously we went through a couple different brand revisions before I sold my practice. So I totally get what you're saying. I totally agree. And by the way, that's not all doom and gloom for dentists, right? It's actually fantastic because you can bring on more associates. You can leverage your team. You can lead a practice and not be basically the bottleneck, which is the way it was when I got out of dental school, right? Yeah. There's opportunities in what you're discussing that I think, that far, far, far outweigh any negatives, but it does require for some people maybe to kind of shift their ego mindset to be like, it's not about me, it's about providing care for the patient. And I know that that's something that you're passionate about, is looking at dentistry through the perspective of the patient, which has been a big theme. It's called the Patient First Podcast for that reason. So could you talk a little bit about what that means to you? I mean, I know you've already discussed it, but could you expand on a little more, kind of what dentists can do today to shift their practice or dental organizations to incorporate the patient's perspective more?
Yeah. And that's a great question. And oftentimes if I'm lecturing in a room full of dentists, I'll have at least one dentist, in the beginning or end, or sometimes raise their hand and say, but Melissa, you're a hygienist. What do you know about running a dental practice? And I say, okay, but take the hygienist out of me, take the business owner out of me and who I am. I'm your target patient. For 99% of the dentists in that room, I'm the target patient for them. I'm a mom, I'm a breadwinner. I am, I can make decisions for my family, and I'm going to maybe be with your practice for 10 to 20 years. And so you take that out, and then you take that out of the picture and you ask me, what do I want as a patient? What do I want as a customer of anything? And I'll tell you 3 things. And it's one of these things, pre-COVID, probably some Gen Xers, most millennials, and the youngers all wanted the 3 things. But post-COVID, now everyone wants it. We all want convenience in everything we're doing. We all want transparency in everything we're doing. And we all want flexibility in everything we're doing. And so if we apply those 3 things to our dental practices, there's a lot of improvement that we can make, online payments, online scheduling, just those things, virtual care, taking care to the patient, flexibility, convenience, and even things like we were talking about, how patients don't necessarily care about interacting with the dentist, they still want transparency. When they walk into a dental practice, they still want transparency because that's what makes them feel comfortable. And that's transparency with payments, with, okay, we're running 10 minutes behind because the patient before you showed up late. So sorry about that. Okay, we'll just move forward, right? It's that kind of a mindset that we want. And also too, and we probably don't even have time to talk about this, but shifting our dental practices from a disease-based model of care to a preventive model of care, that's coming down the line. That's already here in healthcare. And it's a very difficult change, and you often lose money up front. But in the long run, what studies are finding is that it is more profitable to be a preventive clinical program model versus a disease-based one. So that's a different podcast probably, but that's another mindset that's coming down that patients want, because most patients my age now aren't necessarily, well, upper class, middle class, aren't really missing teeth, right? They have a few fillings. They're not going to need the full dentures. We know that. They may not even need a lot of implants, right? When we get older. So shifting to a preventive, maybe a cosmetic focus is going to be necessary in the future too. But again, that's a different podcast.
Yeah, no, I agree. And everything you said, and I really like the three themes that you had. I mean, obviously, like you said, the whole shifting to preventative, I'd love to double click on that at a later date, because I think it's I agree with it completely, but it is that there's a lot to sort of unpack there. But the topics of convenience, transparency, and flexibility are hugely important. And I think that anybody listening to this that has anything to do with dental practice should take note of and should write those down and think about how to apply those to their practice tomorrow, right? Because I do believe, I kind of think it's convenience, and convenience, and then quality of care. But quality of care has to be a given. But flexibility and transparency is, I think those are kind of important call outs. I'd like to have you, the one that I think we probably have time to sort of double click on a little bit is flexibility. What do you mean by, when you're talking about flexibility from a patient's perspective in a dental practice?
From a patient's perspective.
So I've got ideas in my brain what it is, but I'd love to hear yours.
I've got a list. Do you want me to start at the bottom, the middle, or the top? The easiest things for patients are top of mind, bottom of Maslow's hierarchy. They just want to get in, get out, and get home. Make sure that they don't pay too much. Make sure they can still pay their bills, put food on the table, make sure their kids are growing up well. Okay, so that's what patients want right now. So when we're talking about flexibility, it's going to be ease of making the appointment, ease of payment. And then also, if I need to switch my appointment, don't make me feel bad. Don't charge me a fee, right? Unless I've done that 20 times already. That kind of flexibility is of utmost importance. But then also, when I'm in the clinical chair as a patient, if I prefer an amalgam filling, I mean, please be flexible with me on that. If I don't want white fillings because I read something on the internet about white fillings and I want to go back to the amalgam or the gold, right? Please be flexible with me about that, because that's important to me. That's a mindset. It might not be best in the clinical mind, right? But it's what's best to the patient mind. So I'll call out those two things right now for flexibility, but there are a ton of things that we could talk about. What are you thinking with that?
Well, I'm thinking more of the latter, right? So I'm thinking there's lots of conveniences that I think everybody should be, because, the way I look at it, if Starbucks has more convenience than your dental practice, there's some issues, right? Because people are coming. What's that?
McDonald's even.
McDonald's, yeah, that's even you're right. That's even a better example. If they're serving you a $1.99 meal and it's easier than your dental practice, we've got some issues, right? But when I'm thinking of flexibility, because I wouldn't do an amalgam in my practice just because I don't believe in them. So that's great. Have an amalgam, go get it somewhere else. That's what I would say, right? There's nothing wrong with amalgams for you. I'm not going to convince you otherwise, but we don't do them here. However, if you're in the practice and I'm thinking, boy, you'd be a great candidate for 6 implants and a screw retained appliance, but you don't have to see the value in that, and you want to have 2 implants and an ERA attachment denture, that's your choice. I can tell you the pros and cons, but like Let's not try to shove our values onto our patients. Of
Mhm.
course, from the perspective, we want to provide the best quality of care we can. And I think part of our job is imparting the value of dentistry to patients. But I think being flexible to meet people where they are, right? If they don't want to do a full mouth reconstruction today, but they want to restore the 3 teeth that are broken and cutting, and they have a problem with, then let's meet them where they are today, and then work overtime to move them up the dental chain. That's where I see. And also, like, let's not berate patients. If somebody comes in and has been to the dentist for 20 years, right? Let's not be the next reason why they don't come in for another 20 years, right? Let's celebrate the fact that they're in the practice today. Give them ways, like you're talking about through teledentistry, to come in easily before they even come in, have a virtual consult. If I haven't been to the dentist in 20 years, I'll tell you what, I don't want to go to the dentist, right? And so let's make it easy for them to have that first step that's easy and safe to connect with your practice. That's what I think about flexibility. And also flexibility, I would say, in large part with your team too. I think that's a big one right now, because people like yourself were a hygienist and now they're moving on to other careers because, probably in large part, I would guess, because of the lack of flexibility in the role, right? And so if we can build that, and there's many ways to do this, again, another talk show, but to build flexibility into the positions in your practice too.
And that's a thing too. And that's one of the underlying themes for me, is that when you start to adapt your clinical business mindset to what your millennials and below need, then it's also naturally going to attract and retain your staff as well, because it applies to them as well. So the convenience, transparency, and flexibility, you nailed it. It's like you can kill 2 birds with 1 stone if you really sit down and focus and become strategic about how you're treating your patients and then your staff. It's an ebb and flow. It definitely is.
Yeah, I don't think anybody ever said, boy, I wish my practice was more archaic. I haven't heard anybody say that. Boy, we have too much technology in our practice. That just doesn't, right? We're too convenient for people. It just doesn't happen.
Mm-hmm.
Well, Melissa, thank you so much for being on the podcast. Where can people go to find out more information about you, your consulting, and what you do?
Yeah, so you're welcome to go to my website, melissakturner.com. There's a contact widget that you can contact me by. You can also reach out on LinkedIn or Instagram. I'm the Tooth Girl on Instagram. That's where the fun side of me comes out, right? LinkedIn is the business side. So 2 different personalities there. But you're welcome to contact me on social media. It'll take a little bit longer to get back to you, or through my website, melissakturner.com.
Well, Melissa, thank you so much. Thanks for what you're doing for dentistry, and appreciate you being on the podcast.
Thank you, Bryan.